So, Chris, what are some of the more common psychotropics that are found being used in care facilities?
Okay. I'm going to have fun with this one because we're going to have a history lesson here, okay? Not too long ago, your dad would remember, barbiturates were very common for sleeping pills. Nembutal, Luminol, Seconal, okay? And they moved away from those, and then they got into the benzodiazepines, the first generation benzodiazepines, Xanax, Librium, Dalmane, Actifed, these drugs. And and drugs that come out of the past, there's one that's really making the news nowadays, is Quaalude. Quaalude was a sedative that used to be used a long time ago. And unfortunately, Bill Cosby's taking some serious hits because of the way he used Quaalude. Also, they have used in the past, it's not recommended at all, that they've used diphenhydramine or Benadryl or Phenergan antihistamines to sedate people. But they have other side effects on the body that make them less than a really great choice to use.
So you should never use an antihistamine as a sedative.
Right, but it's quite common. You still see it. Benadryl, and it dries out secretions. It affects them in such a way that they, that when they get up to go potty or something, there's a problem. But the ones that you see nowadays are basically the Ativan for anxiety. You see the antidepressants, Elavil, there's a whole family of tricyclic antidepressants that were all basically derived from Elavil, and you see those being used, and the anti-anxiety drugs, Xanax, Ativan, they're quite common in the long-term care setting for agitation and this sort of thing. And so basically that's primarily what you're seeing is, and they all have a CNS depressant effect. And the CNS depression is a real serious, because it can be additive. You add one drug, makes them a little drowsy, add another one, and then they're more drowsy, add another one, and you have serious problems, Or you think, oh, they're losing it. So they have a cognitive decline, so we got a pill for that.
Yeah.
And so you start piling on. One of the real criticisms I have of the whole medical system is when you call a doctor, if you're a nurse at a facility, doctor, this is happening. They're so busy, they don't have time to think, okay, why is this happening? They give a pill for that symptom. Well, really and truly, if you call the pharmacist and give him those symptoms, he can tell you what pill to take. The doctor has to analyze what's really going on there, and does a patient need a pill, or do they need an adjustment in a dose, or basically losing a particular medication.
Yeah, just cutting it out completely.
Right, and in one of the things I just went over on the internet, people with normal or below normal blood sugar and normal and below normal blood pressure, the doctors have never, 78% of the doctors have not decreased the medication in response to achieving the goal. Well, you're getting along on 20 milligrams, your blood pressure's fine, maybe you can get along on 10. It rarely happens.
Less side effects and less
side effects, right? And and with the blood sugar, I mean, people can bottom out. It gets very dangerous when you have hypoglycemia, severe drop in blood pressure. I mean, in blood sugar. So,
well, and I've heard there can be some issues with too, where a person will have an issue that they will then be prescribed sort of the wrong medication for. Because I guess one of the ones that's very common is that someone will start having a lot of cognitive issues, and they will think that it's onset of dementia sort of thing, and they start getting treated for that when really they have a urinary tract infection, and that's what's messing with
That's
their
right.
cognitive abilities.
It can be a urinary tract infection, or the other interesting thing that happens, and it's well documented, as you get older, like I am, you don't absorb vitamin B12 well. You just, your GI tract doesn't absorb it. And if you're given a medication that can block it, now you're severely deficient in B12, which can have cognitive effects and also can have effects on peripheral neuropathy in your diabetics. So, yeah, piling on drugs does cause an issue. And Medicare, CMS is now mandating review of these medications to see if they're appropriate. We have lists of patients that come out of our computer, and we call them up, and then we also fax the doctor saying, "Doctor, patient's on a hazardous medication. There are options." And they're made aware of it. They don't always respond, but in many cases it's helpful to the patient.